It's time for our weekly coronavirus check-in with Dr. Zorba Paster.
Dr. Zorba Paster will be taking your questions in the next segment. He joins us from his office in Oregon. Welcome back.
Hi, Zorba. Good to see you.
Good to be back. Good to be back.
Let's talk about antibodies. There's some concern that they might only last for a couple months.
Right. There's a very small study, not a big study, and remember this is science and evolution, that seemed to show that people who were not symptomatic, but we have good research that shows they did have coronavirus, they did have COVID, had antibodies that appeared to disappear after 2 months, 2 or 3 months. Now, in some ways, you may look at this and say, this is really bad, it's not going to be a good thing, it's going to be a problem. But if you look at influenza, every year we get an influenza shot because the antibodies tend to disappear. And sometimes during a bad season, we might even get a second shot. So it shows you when we're developing the vaccine, and vaccines are coming along on the horizon, we do not have a workable vaccine now. We've got to get one that's robust enough to last, but it may be just like influenza. It might be you'll have to get your corona shot every year. I do believe that when the corona vaccine comes out, many people who didn't even get the influenza vaccine are going to get the corona shot.
Yeah.
So.
Do you recommend that people get the antibody test? I know we've been talking a lot about how, what's the word?
Effective.
Effective it is, yeah, and that there's a lot of false, sometimes it's not always accurate.
False positives, false negatives. So the false positive says, hey, you have antibodies, you don't really have them. And the false negative says, hey, you don't have antibodies and you really do have them. So the problem is the test is maybe 85% at most really reliable. Depends on which test you're doing, but unless you're in a totally research institution where 2 or 3 tests are being done, it's nowhere near the 90 or 95% range. The second thing is, but now that we know that the antibodies may tend to disappear, what does it mean if you have antibodies in the first place? It may not mean anything at all. So my thought is, antibody tests really do not have a place yet unless you're actually doing something. You're actually sick, you're ill, in which case they really do mean something. But if you have no symptoms, you haven't been really sick, I think it's pretty much a worthless test and may give you a false sense of security. So you don't wear a mask. You go, oh, I don't need a mask because I don't need one, and that's something, of course, we really all should be doing.
270-9933, the number to call to talk to Zorba. We'll get to your calls. Florida's farm workers, they hit very hard by this, and now they're moving north for the harvest up here. What's concerns there?
Right. Well, it's a concern because that's basically how, in the 1918 pandemic, it was basically fed by the GIs coming home. And when we look at farm workers moving around the country, once again, just like meat packers, they tend to be in congregate settings. They're working close hand by hand. So if one person has COVID, other people may have COVID too. And I think as we see farm workers coming up in Wisconsin, going north, we might see outbreaks of COVID where they are, simply because they may have somebody in their midst who actually has it. And that means they really have to try to do a better job in the congregate setting where they're actually living. And to actually do that is not going to be easy because, as we know, the facilities that they live in are not what you would call up to date. They're certainly not the Fairfield Hotel by Marriott by any means, and that's really the issue. But trying to keep it clean, wearing masks when they're in the setting, putting up plexiglass, that may help. It all makes a difference. All of it matters, but social distancing is the most important thing.
All right, 270-9933, the number to call. We'll get to your calls right after the break. Stay with us.